So that's going to be one of the factors that affecting adoption.
So I shouldn't quit my job and go start the cursor for doctors. Welcome to Human in the Loop, a series where we discuss what it takes to build and deploy real-world systems for the enterprise.
Welcome to Human in the Loop. I'm Drew Clearman.
I'm Darwin Su.
I'm Emily Xue.
And today we're talking about what's different about adopting AI in healthcare. But first, let's start off with some context. Emily, can you kick us off by talking about who are the different players in the healthcare ecosystem?
Thanks. Absolutely. This is actually a very insightful question because every time people talk about healthcare, feels like a single domain, a single use case. But the situation is there are just so many, there's several very important players in this domain. And then when we actually say serve healthcare, we really need to think about who are we actually serving, right? The most important part at the center is the patient, is the human ourselves. We provide healthcare and then we actually have better outcome for patients and then better health and longer lifespan. And then very importantly is the provider, is the healthcare provider, the physicians, the clinicians, the medical centers will actually provide healthcare to patients. And also very, very importantly in the ecosystem, in the economical setting, there are payers, the insurers, they're actually paying our bills. And they also play a very important part of this ecosystem, defining the quality, defining how, from care to revenue and then to make the whole system sustainable. And there's also a very important part we shouldn't actually ignore is the life science, is the science part of it, it's the innovation part of it, the pharmaceutical companies, the innovation in terms of medication, new treatment plans. And there's also medical device manufacturers. So, and then electronic medical, IT part of it, providing the electronic medical system for us to use. So there are just so many players in the system in healthcare. When we talk about AI for healthcare, we really need to cover all of them.
Emily, when we think about grouping use cases within the healthcare ecosystem generally, how do you think about kind of bucketing them?
Yeah, that's also a really great kind of follow-up question. So I think to start with, people really think about is the care quality of the patients. That's kind of a major part of use scenarios. And also very relatedly is actually the provider, what we say is the care for the providers, how provider can effectively and efficiently work in this environment. How could we reduce their cognitive load so that they can spend more time thinking about the care plan instead of all the logistics. And then there's in terms of care team, it's not just the physicians. There's also nurse. It kind of is a huge care team, and how they actually do the scheduling, prioritize different cases. And this is the logistic part, the operational part of this, also very super important.
All the administrators that are involved in
exactly all
care.
The administrators and schedule your appointment, follow up on your appointment, make sure your appointment is effective. You're all very well prepared for it, right? And there's also getting closer to the payer side on the administrative part. There are people who are actually doing all the coding. So what is the diagnosis code? What is the procedure code? So that your bill, your claim could be processed in a smooth way from the insurance side. And I know Drew is laughing. And Drew is actually working on those scenarios. Maybe he can chime in more on that. And also other use cases, as I mentioned, also Drew is working on is the pharmaceutical side of it. How could we actually think about innovations in new drugs, discover new drugs, and then repurposing existing drugs for new use scenarios.
Yeah, I was going to say, I think from a hierarchical perspective, you kind of have the operational side of healthcare where you're dealing with claims and different connecting patients to payers to insurance companies to also the healthcare providers themselves. And then there's kind of the research domain side of healthcare when you're dealing with pharmaceutical type of customers who are more interested in open-ended questions like research. And I think the two different types, those two different sides of the entire healthcare chain kind of have different types of problems when you're talking about AI applications. I think in the research side or, in the pharmaceutical side, there's a lot of open-ended research questions where AI can kind of help you make new discoveries and maybe aid in the research process and hopefully, provide some deep research side of that. Whereas on the operational side, it's much more rule-based workflows where you're trying to get, AI systems to kind of follow systems that are pretty well-defined, like the system of obtaining like coverage for some healthcare providers or something like that. Those systems that exist are pretty well defined, and I think like that's kind of a different problem is teaching AI like how to abide by those systems and follow them the way humans do.
Darwin, I'm going to start with you. Like,
Sure.
what are some challenges that we face with our healthcare enterprises in particular?
Yeah. Happy to start and kick it off. I mean, I think the most obvious reason why healthcare and AI in healthcare is so difficult is because you're dealing with patients and you're dealing with patients' lives. And there's a long history and way of doing things that's like very well known, at least by the providers, that they would like to continue doing for a while. And I think just everything around the patient behind making sure that outcomes still stay top notch and high quality, protecting data rights of the patients themselves. All of this, the hospitals and healthcare providers who have to run these hospitals are highly or just hypersensitive to the kinds of technologies that they're exposing everyone to. So that makes it highly challenging.
Totally, yeah.
Yeah, I feel like when you hear about AI, a lot of times you think about efficiency and making things a lot faster and a lot of those type of buzzwords. But I think like when you're on the side of healthcare where you're dealing with patients and like healthcare, like reliability and visibility are some of the things that are going to be most important there. And I don't think most people are interested in making their like healthcare more efficient, but hopefully making their healthcare like more reliable and more accurate. So I think like building AI with like high standards in mind is like another kind of difficult challenge that arises in the healthcare space because people and companies aren't really willing to sacrifice any accuracy in terms of the care that they're providing to their patients.
Totally. And then really, I love your point because we're dealing with human life, human health, right? So, and then naturally, this is a very regulated, highly regulated industry because it's the stake is high. And then because of this, the regulation actually introduced a lot of overhead in this process. And then this is where we actually see very complex workflows in the practice. Like, for example, especially in the insurance situation, that we actually have very concrete like coding system and then really try to capture this in a precise way. But meanwhile, it actually introduced a lot of overhead in physician when they're doing practice and to think about how to record each step. What are the decisions in terms of diagnosis? What are decisions in terms of procedures? So all this actually introduced this complexity that's in the current practice.
Yeah.
And then when we get AI into the domain, when you think about how it can do compliance, how it actually support the current workflow, meanwhile, try to figure out a way how to simplify things, but really under the regulation. So that's kind of one of the key challenges here.
And I think that's like a really interesting point that all of this regulatory overhead creates so many challenges within the healthcare. But I think that's actually the reason why healthcare executives are so interested in AI because it also presents an opportunity to help remove some of this overhead.
That is totally the opportunities here.
Yeah, I think on that topic, like healthcare is also an industry that's like highly specialized. People that work within healthcare oftentimes have extensive educations and really understand the domain that they're working in really well, which kind of provides extra challenges when building with AI because a lot of times frontier models might lack some of that domain-specific knowledge that is really critical in order to providing like that level of care that patients and doctors kind of demand. And so I think like the level of regulation and the level of like specialty and speciality, I guess, in healthcare is kind of an added challenge that you have to think about as well.
This is a great point. Actually, I'll naturally allude to one of the another thing I want to talk about is like in addition to like practice and regulation and healthcare from a life science perspective is actually a very challenging. There are more unknowns than knowns. Like a lot of cases, if you talk with the doctors, and this is the biggest lessons I learned in my past experience when using deep learning for healthcare is the doctors actually also doesn't know a lot of the cases. Yeah, and there's no ground. Like if we think about like machine learning, we always talk about golden data set, ground truth label. But in a lot of scenarios, there's no golden label, especially when we talk about human body, how it actually react to different scenarios. There's a lot of like guesses, and then there's. In terms of like life science, there's like human body is really complicated, and the knowledge we know versus the huge amount of like unknown space is actually contributing to a really interesting domain where generative AI is actually creating a lot of new opportunities as well.
Yeah, this is a good point, which is machine learning in healthcare is not new. It's been around for a while. Can you guys talk about what is new, like with Gen AI in particular? What's different with what's available to healthcare providers now than what used to be available before this whole revolution?
I think I can maybe start off with somewhere like the lower hanging fruit. But for me, one of the biggest things is a lot of healthcare data and healthcare data where people use traditional machine learning was highly structured before. And now with Gen AI, one of the big advantages that you have is that there's a lot of unstructured data as well that now is interpretable by these models, and you can leverage it for the various different use cases that we've already touched upon today. And so I think that's like probably one of the main things, whether it's clinical notes that are scribbled down on a piece of paper and are now in a fax or PDF somewhere, to just various insurer reviewer notes that they've also written down. A lot of that can now be translated into context that can be actionable.
Yeah, totally. I mean, one of the projects that Emily and I worked at right when I started was kind of, I think, in addition to unstructured, like even more new than Gen AI is like the ability for models to have vision capabilities, and you can understand multimodality within the data that exists in healthcare. I think, charts, images, just PDFs, different types of documents are kind of what makes up the healthcare data. And now that models are becoming more capable and able to interact with these different types of data sources and understand charts and summarize images and stuff like that, it kind of unlocks even more potential for like different AI use cases.
Totally agree. And then in addition to like the data modality, like structured versus unstructured images and PDFs, there's also the different types of sources of data, right? Like I know Drew has been working on like looking into clinicaltrial.gov, like Met. So, and then there's like data behind different APIs, like the Epic electronic medical system. So there is a need actually in a lot of the decision-making process need to really synthesize information from different sources, and at what point what information is needed, how we retrieve those information that's relevant to the point of care, related to the point of like query. So this kind of the agentic capability of the large language model and the agent system is kind of really capture the large range of information sources in addition to modality. And that's actually kind of a really cool thing about generative AI for healthcare.
I imagine, Darwin, when we first start working with some of our healthcare customers, we spend a lot of time on, Emily, what you just said, which is preparing the data, getting it ready to even be fed into the system. Like, can you speak a little bit about that when we first start implementing AI at a healthcare organization?
Yeah, I mean, there is a very rigorous process that most of our forward deployed engineers and machine learning engineers follow. But it all really starts with getting what we call this like golden set or ground truth data set curated, cleaned, and sort of created in a way that very closely matches human preferences, because I think that is the most important thing that many people don't necessarily get right, especially off the shelf. And so, yeah, that process I think is something that we work hand in hand with subject matter experts, typically at our clients, to collect, curate, and then align on, and that forms the foundation for really all of our LMs and all of our agents that we build.
Well, and I imagine, too, we're really looking what you said earlier about accuracy, right? And so, like, the accuracy, the error rate has to be way lower than for other verticals. How do we deal with that? Like, Emily, you're saying, with the human body, there might not really be this golden set. Like, how do you marry those two things, having a high standard of accuracy while still, being fit for these outcomes?
Yeah, I can start with that one. I think like one of the things that I've learned doing some stuff in this space is that I think there's like a natural kind of like will to kind of over automate things and build an AI system that's going to automate everything that you do in a particular work or use case or something like that. But I actually think that one of the big learnings has been like human in the loop checkpoints and making sure that the model, is comfortable admitting, when it maybe lacks information. Because I think a lot of the times in use cases that we're seeing in like claims or healthcare operations, there's lots of opportunities where even humans don't have the information that they would necessarily need to finish a workflow. And so the agent that's trying to replicate or, aid that process for a human should also follow that same thought process of, oh, hey, I don't have this information. I would need this to finish the case. I should maybe like raise this to a human or something like that. And I think like just including humans in the loop in healthcare is like one of the key things that you can do to make sure that the standard of care is in line with what a human would be providing if they were going to do a similar use case.
Yeah, this is a really good point. It also linked with the previous question we were asking about the data in healthcare, right? If you think about data, there are two types of data. One is the explicit data in the kind of the sources of documents and electronic medical records and all the document we have. That's kind of one type of data. But there's also this implicit data knowledge that actually in the doctor's mind, right? And this is where like rules in human in the loop kind of is very important, because this kind of data is typically not explicitly captured the best practice. And then in the foundation model development, we call it like human preference. That is actually used to align the model behavior. And here what we need is actually how we can capture humans' preference. Like in the project Drew has been working on, it's kind of the record time and Darwin's leading is kind of, if we have a PDF of electronic records, what are the relevant information that the doctor wants to see from this document? This information is implicit information from the many years of practice from the physicians. And we actually provide a system to capture this information in an explicit way and allowing us to understand what accuracy is. Because if this information is not captured explicitly, then there's no way we can actually define metric to measure it and then close the loop there. So that's kind of the first critical step to understand the gap and then move towards improving it.
Yeah. Another kind of major area that I'd love to hear your guys' discussion on is about that risk that we talked about and a little bit of the stigma of having healthcare applications. And I think, Darwin, in particular, I know you're working on a customer use case that is a patient like facing application. So how do we go about choosing an AI like use case that is both high impact but potentially like lower risk or deals with the risk?
Yeah, no, that's a great point, and it's one of the most challenging things I would say about building in the space because most hospitals want to undergo or want to experiment with AI in a use case that actually matters, right? They don't want to just do pet projects, but and most of these are patient facing, but at the same time, they don't want to take on so much risk that this can backfire very quickly. And I think in general, patient skepticism about AI today is still quite high. And so like when you or I are on, customer support for any of our various bank accounts or whatever, we always say human. And so like, how do we actually scope this, I think is important. We really need to go work hand in hand with our champions at our customers and figure out, hey, like what are the use cases that quite matter, typically from a provider time perspective. And so it can be quite changing or quite life-changing, I think, for most of these providers' care, but that when interfacing with a patient, there is still an option to really either escalate or exit the AI experience, so that there's sort of like an off ramp, and so this is something that we think about daily, and it all involves a lot of testing, and so it's still a process that we're figuring out.
Yeah, totally agree. And this is kind of like, especially with one of the first product we roll out at the kind of physician's hands and using the record time. So one thing I actually learned from, Darren's practice is actually interesting in the sense it's kind of like sort of continuous rollout. So what I mean is like we start with two specialties, right? And then we really want to kind of test at a smaller scope and see, whether it really improve the physician quality time, and then as a result improve the overall care quality. And then when we see significant improvement and then positive outcome, and this is where we kind of expand and roll out to more specialties. And the way I think is interesting is to think about a lot of the engineering practice, think about like large-scale distributed system rollout. We do very similar practice. We just roll out 5% of the traffic to the customers and see how it responds. If it's good, then we roll out from 5% to 10% and gradually. So that's kind of a way to de-risk in certain way. Yeah.
Yeah,
great point.
I like the way you guys put that. I think like to your point, like there is definitely a stigma of using AI, especially in healthcare. And I think like when Emily's talking about slowly releasing these things, one of the things that allows us to do is have really tight feedback loops with the end users. Because I think at the end of the day, getting direct feedback from maybe people that are doing a similar task to what the AI agent that you're building is trying to do, those are the feedback that's going to be like the most influential in how you should be developing your AI agent. And I think like there's a tendency for us to kind of try to maybe like replace systems that have existed for a long time and are very intricate and delicate that, are maybe very manual, and AI can definitely make a big impact there. But I think rather than trying to like replace some of these systems, it's like a better goal to try to aid the people that know the systems really well and make them more efficient rather than completely going in and changing the whole systems. And I think that's maybe where some of the skepticism comes from. I think like with good forward deployed motion, where you're actually integrating your AI system into systems that actually already exist, and rather than changing them, kind of just making them more efficient, it kind of can help ease some of that like distrust that people have around AI.
Yeah, that's a great point. And I think as you were speaking, that reminded me to just that like being transparent,
Yes.
And very clear about like the accuracy of the AI you're delivering, and also setting expectations right so that the customer knows what to expect, is like a huge part of just making people more amenable to AI applications.
Totally agree. The transparency is actually the foundation to establish trust.
Mm-hmm. Can you guys say a little more about that? Like, obviously, there's when we're working with them, but how do you see that transparency impacting the rest of the organization or the rollout or adoption of some of the customer work we've done in the past?
Yeah, so I can speak to that a little bit. Emily has alluded to one of the applications that we've been building, which is essentially document extraction for a large hospital system. It's the rollout strategy that we've employed is specialty by specialty, which is typically how that hospital operates. There's like a head of a specialty, and they do things a certain way, and there's a very tight communication loop between the head of that specialty and all the physicians that support it. And so what we've done with that use case is we roll it out so that it hits a certain level of performance that is acceptable in production, and then roll it out just for that specialty so that it can develop trust there. But of course, hospitals aren't in a silo, and people are interacting with each other all the time, and so adjacent specialties are the next ones we tackle, and then the rollout. And so accuracy is then the topmost concern there. And so like as we slowly roll it out in this sort of phased type of way, that's really how we transparently can communicate to our customers.
Yeah, that makes sense.
Yeah.
I think another point is there's the phase rollout. There's also, back to what Emily was saying in the beginning, there's really 3 application areas for AI. And so the most high risk, I imagine, is like on the insurance side, on claims providing, as well as on the patient side. Yeah. But there is a lot of low-hanging fruit, right, on the operations side, like on that administrative piece. And so I imagine that some advice we might give, or I don't know if you would have takeaways for healthcare execs who are listening to this, but one of them might be think a little bit more broadly about where you're trying to apply and bring Gen AI into your organization.
Absolutely.
Yeah, I feel like people a lot of times kind of equate like AI agent with chatbot, but I feel like most of our engagements, that's not exactly what the agent is going to look like, and so I agree. Like thinking broadly.
What can you give us a little flavor of what outside of the chat? Thinking outside of chatbot, what can some of those agents look like?
Well, I feel like an AI agent at its core, should be able to like interact in the environment that it's in and produce artifacts and kind of use tools to understand the case or the situation, or maybe the research report that it's doing in a pharmaceutical use case, for example, and actually produce an artifact at the end, not necessarily like a chat response. Maybe that is what it is for a deep research context. Maybe like something like a chatbot makes sense and is kind of like the canonical AI implementation. But I think there's lots of other cases, especially when we're talking about these kind of rule heavy operational different types of workflows that happen across the healthcare industry. There's still areas where AI can be incredibly useful, even if it's not something that's maybe like a user-facing chatbot. It can just increase efficiency, help people gather information, even provide summaries of really long documents. I think medical data is like notoriously very messy. Doctors' handwritten notes, you can't read them, something like that. Different data has spell checks, all that kind of stuff. And I think like that kind of is the unstructured data that Darwin was alluding to earlier, that AI is really good at kind of contextualizing and summarizing to humans in like something that's much more digestible.
Now we're going to move on to my favorite segment for all of these episodes, which is AI hot takes. So can you guys verbally confirm, have any of you seen these takes before?
I have not.
No.
Absolutely
I have not.
no. Yeah, no.
I tried.
Darwin tried. The limiting factor for AI in healthcare isn't safety or regulation, it's reliability. 3, 2, 1. All right, why? Whoever wants to take it, why?
You want to take it first?
Yeah, I mean, I think, something like we were talking about earlier, I just think like if not reliable, then these systems are essentially worthless in the healthcare space. right? Like I think that should be like the primary metric that we're driving. Of course, like compliance and stuff is important and necessary. That's like kind of a necessary first step. But I think in most cases we're able to get past that, and then hill climbing on like the reliability aspect of the system is like kind of the most difficult and like limiting factor. That's like critical.
I mean, I agree with your first statement, which maybe that is a hot take. Without reliability, AI is useless. I think, obviously the regulatory aspect, the safety aspect is still super important. But what we're really seeing with a lot of our customers, and Emily, Drew, and I talk to customers all the time, is that they're very open-minded to trying new things. And so I think as long as you can get the reliability piece right, then a lot of the other hurdles can start to fall away.
Yeah, actually, I think about is like there are layers of requirements, and the reliability is really at the bottom of it, right? So if without, like what Drew said, without reliability, you can't really talk about patient safety. You can't really talk about how you can comply to regulatory requirements. So that's kind of the most foundational block that we need to satisfy first, and then we can build other requirements on top of it.
Great. So not really a hot take. Love it. Right now, the biggest win for AI in healthcare is fixing everyday operations, not transforming patient outcomes. 3, 2, 1. Ooh, let's start with Emma. Let's go down the line here. Emily, why are you sort of in the middle?
It's kind of partially agree with it, because if you look at a lot of the applications and a lot of the startups in this area is really trying to make the whole operational side of more efficient. So that's partially true. But then on the other side, you also see a lot of like really deep innovations on the research community. Like AI for science is actually a big thing. And recently I've actually been to AWS re-event and also look into the agenda from the Europe side. So absolutely you can see the life science, AI for life science is actually a big thing. And then because the large language model actually incorporates such vast amount of humanity's knowledge there, it really provides meaningful support for advancing science in this domain. So it's not directly primary care, but through the innovation in life science, in new medical medicine discoveries, that really provides a kind of value for advancing the patient care outcome.
Darwin, you were a thumbs up. You agree.
I agree. I think it has to do with just the fact that most of the startups out there right now are tackling operations, so to speak. I think that the operational side of it is also lower risk. And so adoption, at least today, should ideally be faster if you have the reliability piece figured out. And then lastly, I just think that there's just so much overhead right now in healthcare that, if you don't really need to advance healthcare in order to make AI be useful, you just need to take care to where it is today. And, maybe beyond that, actually healthcare itself has to get better. And so I'm just a little more optimistic about that today.
I like that point, but I also feel like kind of in some engagements, like, first of all, I think a lot of companies within the healthcare space are very mission driven, and for good reason. Like you're not really in healthcare, you're not trying to necessarily drive like ROI, but rather you're trying to provide patients access to care or something. And I feel like in some of the engagements that I've been focused on, there's a lot of situations where patients have to go through appeals processes in order to get coverage to the like different medications that they might be requesting. And I feel like part of our mission, building AI to maybe help make these systems, not only more efficient, but also kind of fix some of the errors that happen along the way. And ultimately, I think like the driving metric should be like get patients access to healthcare faster. So like even if we're making a system like slightly more efficient, like the motivation behind that is ultimately, I think, to increase or decrease the like time to care.
I really love this point. Maybe I can double click on this and talk a little bit more on this. Because one thing, if you think about the challenges in healthcare or like different views on healthcare, is really about the horizon to get feedback, right? On the operational side, if it's successful, if you see meaningful improvement in operational efficiency, then the time to success, the time to get feedbacks from the field is actually relatively short. But on the other hand, in much more open domain science investigation, like medicine discovery, and then that like improving human care, like understanding human body and improve the understanding of like the medicine field, the feedback is actually very long because for each clinical trial and for the feedback, it's not talking about months, it's years. There's longitudinal effect there. So that's kind of where a lot of the challenge in healthcare improvement is, because you cannot really see the improvement of it within just months. It could be years, and the feedback loop at a longer horizon also is another factor here. And then if we want to capture like short-term ROIs, like from a startup's perspective, then they actually would bias towards the operational side of it. But we shouldn't really ignore the other kind of long-term investment in the field.
Right.
Totally.
Right. All right. Our final hot take is actually a little bit more of a prediction. So I'm going to ask you to look into the future. Within a year, AI tools will be as ubiquitous in healthcare as vibe coding tools are in software. 3, 2, 1. Ooh, thumbs down. All right, let's start, Drew. Thumbs down.
Well, I just think it's really hard. Like, I think like when we're talking about like pharmaceutical use cases, for example, these are PhD level researchers with 20 years of experience, and like AI is working to help them do their jobs efficiently. But I think it's like a lot easier to make AI that's going to help like a junior software engineer, I think. And I feel like the code stuff has come a long way, and 1 year is like a short amount of time to the point where we would be at like Cursor for doctors.
Yeah. I think for me, it's like the diversity of workflows is just so insurmountable that, even earlier when we were talking about healthcare, all the different parts of healthcare, there's at least 4, if not, depends on how you classify it, but just like creating one sort of tool that can fit all of them is going to be near impossible. So I'm not as bullish.
Totally. And think about like two things. One is we talk about this is a really high stake kind of area where the adoption it's like coding. Okay, one thing is think about is like all the models actually one or another was developed by developers. We know the environment really well, and then we feel very comfortable actually adopting our technologies into our workflow. And then in this scenario, because it's high stake and a lot of people are actually not that familiar with the development process of AI, and meanwhile the developers of AI is not familiar with their environment. The thing they build, they may actually not fit in the environment really nicely. So that's going to be one of the factors that affecting adoption.
So I shouldn't quit my job and go start the Cursor for doctors. Okay, that's it. That's a wrap. Thank you guys for joining.
That's a wrap.
Cool.
All right.
Nice.
That was fun.
That was fun.
Thanks for listening to Human in the Loop. To stay in the loop for more AI-related content, make sure to like, comment, and subscribe.